Hey everyone, and welcome to The Explainer. I'm Angie D, and today we're going on a really fascinating and honestly, potentially life-saving journey into your cardiovascular health. We're going to be decoding the direct, undeniable link between high blood pressure and stroke, and we'll be doing it by unpacking the absolute latest clinical guidelines. If you've ever stared at a blood pressure cuff and wondered, what do those numbers actually mean for the super delicate vessels inside my brain? Well, you are in exactly the right place. We're going to map out the physical mechanics of how this happens, how to spot an emergency instantly, and most importantly, the exact data-backed blueprint you need to protect yourself. Let's get into it. Okay, so we often think of major medical emergencies as these loud, incredibly painful events with tons of obvious warning signs, right? But high blood pressure or hypertension is notoriously known in the medical world as the silent killer. And why is that? Well, according to the American Heart Association guidelines we're looking at today, you can literally have severely elevated blood pressure and experience absolutely zero symptoms. None. No headache, no chest pain, no blinking warning lights. It just hides in plain sight. It is basically the ultimate stealthy culprit, quietly setting the stage for a catastrophic cardiovascular event without giving you a single clue until it's often too late. To really wrap our heads around this, we need to look at what hypertension is physically doing to your body. Think of your cardiovascular system like the plumbing in your house. Your heart is the main pump, and your blood vessels are the pipes. Hypertension simply means that your blood is pushing way too hard against the inner walls of those arteries. If you can imagine leaving a household faucet running at absolute maximum pressure for years and years, you know those pipes are eventually going to break down, right? Well, your arteries act the exact same way under that relentless, high-velocity flow. It's fascinating. Actually, scratch that. It's pretty alarming to look at the cumulative damage. The American Heart Association points out that as we age and as that blood pressure remains high, our large arteries literally become stiffer. This constant, high-pressure scouring inside your vascular pipes creates these tiny, microscopic tears and weaknesses in the vessel walls. Over time, that damage creates the absolute perfect environment for plaque to build up. The walls become rigid, they narrow, and they get fragile. You are essentially creating the ideal crime scene for a stroke long before the actual event even takes place. And it's this foundational damage that triggers two main catastrophic events when those damaged pipes finally do fail. We're talking about ischemic versus hemorrhagic strokes. First up, ischemic strokes. This is the most common type, and it happens when blood flow to the brain is suddenly blocked off, usually by a blood clot getting wedged into one of those narrowed, plaque-filled arteries we just talked about. In stark contrast, we have the hemorrhagic stroke. This happens when the relentless pressure finally causes a weakened vessel wall to just burst, bleeding directly into the brain tissue. They're two totally different mechanisms, but both are triggered by the exact same foundational damage of high blood pressure. So the absolute key here is recognizing the warnings before a massive event happens. Enter the TIA, or transient ischemic attack. Now, you might have heard people casually call this a mini stroke, but I want you to completely erase the word mini from your vocabulary right now, because there is absolutely nothing small about it. A TIA occurs when blood flow to a part of the brain is blocked for a really short time, and the symptoms usually disappear within 24 hours. But here's the alarming statistic from our source data. 1 in 3 TIA patients will suffer a major stroke within a single year. It's basically a blaring siren telling you the culprit is in the house and you need to take action right this second. Knowing those stakes, what does an actual emergency response look like? Well, if a stroke is happening, every single second counts. The 2026 American Stroke Association guidelines strongly emphasize the ultimate memory tool to instantly spot a stroke, and that's F.A.S.T. Face drooping. Does one side of the person's face droop or is it numb? Arm weakness. Is one arm weak or numb? If you ask them to raise both arms, does one drift downward? Speech difficulty. Is their speech slurred, or are they suddenly unable to speak or just really hard to understand? And finally, T is for time. Time to call 911 immediately. No hesitation. Now, while F.A.S.T covers the most common signs, stroke symptoms can sometimes be kind of subtle and easy to miss. So the guidelines clearly outline some critical secondary emergency symptoms you need to know about. Imagine experiencing sudden numbness or weakness in the face, arm, or leg, especially if it's just on one side of your body. Or maybe sudden changes in your vision, acute confusion out of nowhere, or a really severe unexplained headache. These are massive red flags. In fact, the Emergency Severity Index categorizes a new onset of confusion or lethargy as a highly critical warning. Any of these happen, that warrants an immediate call to 911. Do not wait around to see if it passes. So why are we so intensely, relentlessly focused on calling 911 right away? Because time loss literally leads to more brain loss. Treating an acute ischemic stroke is a literal race against the clock. When you get to the hospital, the medical team is going to evaluate your stroke severity, often using something called the NIH stroke scale, to figure out if you're eligible for highly specific, very time-sensitive treatments. For example, IV thrombolytics. These are super powerful clot-busting drugs like alteplase or tenecteplase. They're a mainstay of medical management. But here's the catch. They generally must be administered within a strict 4.5-hour window from when symptoms started. Delaying means you take those life-saving tools completely off the table. Okay, let's take a collective deep breath for a second, and let's shift our narrative. We've covered the emergency response, but the real victory outlined in these guidelines is preventing those emergency protocols from ever needing to be used in the first place, right? Managing your blood pressure isn't just about avoiding bad things. It's about looking at the data, taking back control of your health, and actively writing a healthier, more vibrant story for your future. Let's look at your exact blueprint for prevention. It all starts with knowing your target. Normal blood pressure is less than 120 over less than 80. But according to the American Medical Association treatment algorithm, once your systolic, that's the top number, hits 130 to 139, or your diastolic, the bottom number, hits 80 to 89, you have officially crossed over into stage 1 hypertension territory. If you are consistently reading 130 over 80 or higher, you are actively causing that physical damage to your vessel walls that we talked about earlier. To keep those numbers safely in the healthy zone, we need a solid toolkit. The clinical guidelines strongly recommend some foundational lifestyle modifications. First up, the DASH diet. That stands for Dietary Approaches to Stop Hypertension. Basically, this means eating a heart-healthy diet packed with fruits and veggies and seriously limiting your sodium. Second, if your healthcare provider actually prescribes blood pressure-lowering medication, please take it exactly as directed. The data shows medication adherence is a huge hurdle here in the US, but it's a completely proven way to drastically reduce dementia and stroke risk. And third, manage your weight. These 3 tools combined form an incredibly powerful shield for your arteries. Alongside your diet and your medication, what is the magic number for movement? It's 150. As part of a really comprehensive lifestyle modification strategy, getting into a moderate physical activity program is absolutely crucial. The benchmark standard is 150 minutes of moderate physical activity every single week. Whether that's a brisk walk, hopping on a bicycle, or going swimming, this consistent activity helps keep your heart strong, helps maintain a healthy weight, and acts as a foundational pillar for keeping your vessel walls resilient and flexible so they can handle the flow of life. I want to highlight a really specific, powerful quote straight from the AHA's guidelines on target blood pressure. It states, BP control remains critical throughout the lifespan to reduce the risk of heart attack, stroke, end organ damage, and death. Listen, this isn't some 30-day internet challenge or quick fix. This is a lifelong commitment to your cardiovascular health. Whether you are 35 or 75, monitoring and managing that pressure is a non-negotiable part of self-care. It literally preserves your brain, your heart, and your life. So we've seen exactly how untreated high pressure brutally scours your blood vessels. We've seen the catastrophic strokes it can cause. And we've covered the exact steps you can take to stop it right in its tracks. You hold the pen to this narrative. The silent killer only wins if we simply refuse to listen. So my question to you is this. When was the absolute last time you checked your blood pressure? Are you ready to know your numbers today and step actively into a healthier, stroke-free future? Thank you so much for joining me on this explainer. And remember, taking control of your health is for sure the most empowering move you can make. See you next time.